Health insurance. Health insurance is a type of insurance coverage that pays for medical and surgical expenses incurred by an individual or a group of people. It provides financial protection to policyholders by covering a portion or all of the costs associated with healthcare services, including doctor visits, hospital stays, medications, surgeries, and preventive care. Health insurance can be obtained through various sources, such as an employer-sponsored plan, government programs like Medicare and Medicaid, or individual plans purchased directly from insurance companies. The specific coverage and costs vary depending on the insurance provider, the type of plan, and the policy terms. Here are some key points to understand about health insurance. Premium. This is the amount policyholders pay periodically, monthly or annually, to maintain their health insurance coverage. Premiums can be paid by individuals, employers, or a combination of both. Deductible. The deductible is the amount of money policyholders must pay out of pocket for covered services before the insurance company starts to pay. For example, if you have a $1,000 deductible, you will need to pay $1,000 for covered services before your insurance coverage kicks in. Copayment and coinsurance. Copayments or copays are fixed amounts that policyholders pay for specific services, such as doctor visits or prescription drugs. Coinsurance refers to the percentage of the cost of covered services that policyholders are responsible for paying. For example, if you have a 20% coinsurance, you will pay 20% of the covered services cost, and the insurance company will pay the remaining 80%. Network. Health insurance plans often have a network of healthcare providers, including doctors, hospitals, and clinics with whom they have negotiated discounted rates. Using in-network providers typically results in lower out-of-pocket costs for policyholders. Out-of-network providers may have higher costs or may not be covered at all, depending on the insurance plan. Pre-existing conditions. Under the Affordable Care Act (ACA) in the United States, health insurance plans cannot deny coverage or charge higher premiums based on pre-existing conditions. Prior to the ACA, insurance companies could refuse coverage or charge significantly higher rates based on an individual's medical history. Benefits and coverage. Health insurance plans have different levels of coverage for various services. Common benefits include preventive care, for example, vaccinations, screenings, hospitalization, emergency care, prescription drugs, and maternity care. It's important to review the policy documents and understand what services are covered and any limitations or exclusions. It's advisable to research and compare different health insurance plans to find one that suits your specific needs and budget. The terms and regulations regarding health insurance can vary by country, so it's essential to understand the specific rules and regulations that apply to your situation. In the United Kingdom, health insurance is commonly referred to as private medical insurance (PMI) or private healthcare. Private health insurance complements the services provided by the National Health Service (NHS) and offers additional benefits and faster access to healthcare services. Here are some key aspects of health insurance benefits and coverage in the UK. Private hospitals and facilities. Health insurance in the UK typically provides access to private hospitals and clinics. This allows policyholders to receive treatment in a private setting with shorter waiting times compared to the NHS. Specialist consultations and diagnostics. Private health insurance covers the costs of specialist consultations, such as visits to consultants, specialists, and therapists. It may also cover diagnostic tests like MRI scans, CT scans, and blood tests. Inpatient and day patient treatment. Health insurance covers the costs of inpatient treatment, including hospital stays, surgeries, and procedures that require an overnight stay. It may also cover day patient treatment, which involves medical procedures or surgeries that do not require an overnight stay in the hospital. Outpatient treatment. Health insurance often covers outpatient services, such as consultations, diagnostic tests, and treatments that do not require hospital admission. Cancer treatment. Many health insurance policies in the UK cover the costs of cancer treatment, including consultations, surgeries, chemotherapy, radiotherapy, and supportive therapies. However, coverage for cancer treatment can vary, so it's important to review the policy terms and conditions. Alternative therapies. Some health insurance plans may offer coverage for alternative therapies, such as acupuncture, chiropractic treatment, and osteopathy. Medications. Health insurance policies generally do not cover the cost of medications prescribed for routine or chronic conditions. Medications prescribed during hospital stays or for specific treatments